Thank you so much, Melissa. These dark and dreary days of winter mean we're not exposed to the sun long enough to get enough vitamin D, and that could have serious impacts on your health. Here to tell us more is Karim Alami. He is a naturopathic doctor at Stittsville Health and Wellness. Happy New Year. Great to see you again.
Happy New Year. Thank you for having me again.
All right, so I know that a lack of vitamin D can maybe impact your mood, but let's talk about the signs of deficiency here. How can you recognize it within yourself?
So vitamin D deficiency can manifest in many different ways in different people. Often I see fatigue, muscle aches and pains, mood disturbances, specifically low mood, poor immune function. A lot of people have come to know vitamin D as the immune support vitamin, especially after COVID. Skin issues, it can manifest in so many different ways.
Skin issues like what?
Rashes, because it helps.
You can break out.
It helps to tonify the immune system and to support the immune system.
Okay.
And the immune system is something that really helps with healing rashes as well, right? So skin rashes, poor healing of cuts and wounds, et cetera, et cetera. Yeah.
Okay, and getting back to basics, because we just, some of us are around the word vitamin, we know there's vitamin C, we know there's vitamin D, but specifically, what is vitamin D?
So vitamin D is a vitamin. It's a molecule. It can be known as a hormone, or more of a prohormone. It's produced mainly in the skin and converts into the active hormone in the liver and kidneys. It is really important for bone health. A lot of people note for, again, immune function, energy, mood regulation, but the main function of vitamin D is to increase blood calcium levels. It does this three ways. It reduces blood calcium release through the kidneys, so we hold more in. It increases blood calcium absorption through the gut, so we absorb more from our food. And it also actually increases the bones to break down and release calcium. So if you're taking just vitamin D by itself, high dose for a long time, which I'm seeing a lot of people doing, especially again since COVID, you can actually end up harming your bones. They become more fragile because they're releasing calcium. Not only that, the calcium developing, like building up in the blood vessels, can start depositing into the blood vessels, can start depositing into the kidneys, forming kidney stones and arteriosclerosis, which is like a hardening of the blood vessels, which isn't good for us. Right? So something that's really important to do is, if you are supplementing vitamin D, is to take vitamin K2, because K2, not vitamin D, not vitamin K1, not potassium, vitamin K2. K2 takes that calcium and pushes it back into the bone.
Right, okay. And I'm glad that you described it as a little bit of a hormone, because that makes sense when it comes to mood regulation as well.
Oh, it's huge for mood. I've given people injections before, and within a day, they've noticed like significant mood improvements. Again, it manifests in different people in different ways. Some people do have low mood, and we run blood work, vitamin D is low, we bring it back up, and there isn't really a big difference. Usually because there's multiple factors to mood, right? It's not just vitamin D deficiency.
And as we expand on what it does do for people, there's the list here includes fertility.
Yeah, so again, I spoke about the calcium absorption, but vitamin D has an effect on every cell in your body. It binds to receptors on every cell in your body. It affects gene expression, meaning it can activate or deactivate certain genes in every cell in your body. So it literally will affect everything. Fertility, hormone balance, female hormone balance, inflammation, because again, it tonifies. If your immune system is low, if you're getting sick frequently, vitamin D can help with that. If you're autoimmune, your immune system is too active, it can help reduce it as well.
So I know vitamin D certainly helps with those with seasonal affective disorder, but is there a specific demographic that is more impacted by the lack of vitamin D? Because there's a lot of melanin in my skin.
Exactly.
And I'm told that I might need a bit more than others.
Exactly, yeah. So melanin protects you against the sun. Most of us know vitamin D as the sunshine vitamin. It's produced in our skin, and then it's converted into the active form in the liver and the kidneys. Somebody with darker skin color will need more sun exposure. And as you know, in Ottawa, Ontario, Canada, actually.
I was like, let's just keep it
we don't really get a lot of sun.
Okay.
Right? And even if we do, I mean, you work indoors, I work indoors, most of us work indoors. Elderly, because we can get vitamin D also from food. Elderly don't digest well and absorb, and they don't spend a lot of time outdoors. Breastfeeding women, pregnant women, babies, women don't we don't get a lot of vitamin D in milk, right, as babies.
We just have a few seconds left,
Yeah.
so I just want to go over to this
let's go
last
for
one
it.
here, because we know that we can purchase vitamin D over the counter,
course.
but sometimes when it comes to dosage levels and things, we want to get tested, we want to make sure we're doing the right things, but it's not covered by OHIP.
The reason why I like to test, so OHIP doesn't cover it because we assume everybody's deficient and just supplement. That's what conventional medical system says. I like to test because I want to see how much do we need to supplement with, right? I've had people come in with symptoms and they've been supplementing with 1,000 IU and it's not enough for them. I've had people come in supplementing with 10,000 IU and it's too much for them, right? So naturopathic doctors, nurse practitioners, medical doctors, you can ask your medical doctor and just pay for it. Definitely consult your naturopathic doctor before taking any supplements because you can overdose again. Again, sources, sunlight, food like fish, fatty fish, mushrooms. We don't get as much as we need. But supplements, injections, I do give injections to my patients in cases where it's like really low. But depends, it's person by person.
Sounds good. Naturopathic Dr. Karim Alami, thank you so much for being with us. Always appreciate your time.